Hello class. This video is going to augment your readings and your PowerPoint lectures and assignments on the chapter for patient safety, healthcare, quality, and value. And while we're discussing these topics, I noticed that there's a bunch of things that I really wanted to think about and talk about as it relates to the quality of healthcare and the dangers for patients as we move forward in the United States. You know, according to the Center for Disease Control and Prevention, they've got a National Center for Health Statistics that they track information. The United States spends about 18% of our per capita income on healthcare. And that's number one in the world. USA number one, right? Number one. That works out to be about $11,000, almost $12,000 per person per year for healthcare. And that number rose, at least according to CMS, 4.6% from the prior year. Now, the next largest spend in the world is Switzerland, and that's about $7,700 per capita per person. And that gap between what we spend and then the rest of the rich world spends on a per person basis is growing. Every year that gap widens. And we just have to consider that as we look at the quality of our healthcare and the patient risk involved. It's certainly interesting to see with all this money being spent. And we might assume, because we are number one, we spend so much dollars per person, we might assume that we've got the highest quality care. And it would follow that we live the longest as well. These will be logical conclusions. But no, that's not the case, as I'm sure you know. We actually rank pretty low in the outcomes of healthcare, especially when you consider the dollars spent. But even in an absolute amount, in an absolute way, we do tend to fall at the lower end of the healthcare quality for the rich countries. The Organization for Economic Cooperation and Development, OECD, has created a bunch of statistics that another organization, the Commonwealth Fund, distilled into a web paper, and I'll have the link here for you. And the interesting thing is that despite the amount of money we spend on healthcare, our quality has some surprising results. For example, our life expectancy that I said earlier, we are the lowest of all these rich countries, the lowest. And that means we're about 2 years less than average. And we're 5 years less than the highest country with the highest life expectancy, and that's Switzerland, which is a little bit discerning. You would think we could prolong life more here, but we actually have a more likelihood of not living as long due to a bunch of things, and we'll get into those. For example, the United States has the highest rate of suicides of all these developed wealthy nations. And like me, we have a highest rate of obesity in America as well. In fact, we're 2 times the OECD average. And relatedly, we go to doctors less, and we do have less doctors per capita too. And those two things are probably correlated. It's surprising, all these outcomes. And the last thing to think about is the avoidable deaths and preventable diseases that we're hospitalized for. USA is number one on these. We have the largest amount of patients, American citizens, dying for diseases that could be prevented, or deaths that could be avoided. But there is some good news too, right? The United States does rank number one for prevention of some diseases, like flu shots were number one, and cancer screenings were number one. So we do a lot of things great as well. It's just the eye-catching ones where our outcomes are far below average or at the bottom, especially given our expend, that we have to consider the quality of our care. And that's the whole topic that we're talking about, for sure. And relatedly, our text lists a lot of reasons why we have errors and difficulties. But one thing I want to point out is Johns Hopkins did a study in 2016 that specifically claims that about 250,000 patients die every year due to medical errors. That's quite a bit. In fact, it's the third leading cause of death in America prior to COVID. Now that COVID's around, that's moved down to number 4. But we all believe COVID is going to be a temporary situation, and ultimately medical errors will take the third spot for leading causes of death. It's a big issue. And if we think about these medical errors, if we break it back, let me think about it this way. If we break it down by hospital, it's about 6,000 hospitals in the country, and that turns out to be 4 deaths per year per hospital for medical errors. It's big. It's a lot. And if you think about the clinical decision support systems that we study and the things that we potentially can do, we realize that there's a lot of room for improvement in healthcare IT systems today. Hopkins also points out that many of the errors go unreported, and that's part of the challenge because we don't necessarily have on death certificates that the cause of death was an error. It's usually something much more specific to the medical situation itself. And on the topic of patient safety, I'd be remiss if I don't talk about the thing that I focus on in my day job, which is patient safety issues as it relates to medical records. There's the issue of duplicates in every data set in every industry, and healthcare is no different. But duplicate patient records have the potential to have great harm for patients. And let's give an example. Well, first let's define it. A duplicate record, just so everyone has the same definition, is one patient with 2 or more records in the same MPI, the same EHR. That's similar and related to an overlay record, which is one patient record, but 2 or more patient information in that record. That's a very dangerous situation as well, but we're going to focus just on duplicates for the sake of this discussion. Now, the American Health Information Management Association and the Healthcare Financial Managers Association, HFMA and AHIMA, they both put the estimates for duplicate records in EHRs at about 8 to 12%. And that's an average. Number's a little bit old, but it's still in the zone. And if we work out the math, 8% duplicate records, what that really means is every time a patient access person goes to pull up a patient record, they've got a 1 out of 12.5 chance of picking part of a patient record. That means the patient who visits for that encounter will not have their complete medical history available to the clinician. If we look at 12%, the other side of the range, that's about a 1 out of 8.3 chance of picking the wrong patient or picking a partial patient record. 1 out of 8.3. Those are very high odds in either case of getting a patient without a complete record. It's surprising, isn't it? It really is. And the patient safety issue that's associated with this is great. because a clinician may not know about your allergic reaction to penicillin. He or she may not know about a positive COVID test or some prior surgery or other issues you may have had or the patient may have had. So it's a big issue. And I think it's worthy of discussion and thinking about in the context of patient safety, as well as quality of healthcare and the value. And related to patient safety, there are numerous top 10 lists out there that come out every year. And Becker's did one, Becker's Hospital Review, that came out December 30th. And they listed COVID-19 as the #1 patient safety problem. Makes sense, right? Also, the low vaccination coverage of the disease and the resurgence as a result was also critical. Related to some of the class discussion we've had, the staffing shortage in healthcare is becoming acute. Related to clinical burnout, that's long been a problem. Healthcare staffing shortages are starting to really rise up as a top 10 patient safety issue. And relatedly, drug and medical supplies, such as PPEs, is also a patient safety issue. I found it interesting that health equity was listed this year by Becker's. That's related to the social determinants of health, SDOH, and making sure those that have lesser ability to get high quality care at least get adequate care. And that has long been an equitable issue in our country. Lastly, rounding out the patient safety issues from Becker's was surgical mistakes and standardized of safety issues, safety efforts. And they tie that to merger and acquisitions. So when hospitals are being brought together or healthcare systems acquire a different facility, another facility, making sure that their safety protocols are in sync was a significant patient safety problem as well. So you can find these kind of references online when you do research. In addition to Becker's Hospital Review, the Emergency Care Research Institute, also called ECRI, publishes a top 10 list every year of their most pressing patient problems or concerns for healthcare industry. And that's a great source for research as well for this topic. And I'll leave that for you to look up in Google. So anyway, that's my additional data I wanted to pass on to you. Hope it's useful. And I'll see you soon. Bye-bye.